Welcome to this episode of HCA Talks Health. I'm Zena Le Roux, and today I have the privilege to talk to Olly Leicester. And he's a certified corporate health and performance coach, and he works both for the NHS in the New Forest, UK, and also for private clients and businesses. And he's also part of the UKI HCA since it began in 2018, and also an ambassador for the charity Public Health Collaboration, which is helping to fix the NHS, right, one at a time, one person at a time. And when Ollie's not coaching, he likes doing some hot yoga, some cold sea swimming, cooking, walking, or running in the forest, which just sounds absolutely fantastic. So, welcome to the show, Ollie. It's really good to have you.
Yeah, good to be here, Zena. Thanks
Good.
for the time.
Yeah, so Ollie, you shared with me in an email that you really think that given the right conditions, humans are actually designed to be healthy, right? But you also think that these conditions isn't always that, or the conditions and the behaviors aren't always that easy to maintain, right? Especially in our modern world. And this is why I think you're so passionate about health coaching, and where you really believe that health coaching can be the catalyst for creating and maintaining these healthy conditions for us to thrive, right? So it seems like you truly and really believe in the power of health coaching. So tell us a little bit more about why you're so passionate about it.
Yeah, I think you're right. Our environment today in Western worlds is not conducive to creating the best habits and behaviours. So where by default our environment doesn't promote the healthiest choices.
Mm.
So I think that's where coaching can really help people become more aware of that and acknowledge that for a start, isn't it? I don't think it's anyone's individual fault that people go off track in terms of their health, because there's a lot of things going against us mentally and physically. So we're challenged each day. And because I kind of realized I came into this profession having taken a year out myself when I went to Asia in 2017. So I was removed myself from Western culture. And by default, my habits and daily behaviors were really healthy. I didn't really realize that until I came back to the UK, and then I was suddenly bombarded with all the junk food and all the advertising and all the kind of stimulants and prompts that go with everyday life. So having experienced none of that for 12 months, it was just like I liken it to like the emperor's new clothes when I came back, because it was clear to me that a lot of people I came into contact with were ill based on their physical and mental habits. So since then, I kind of dived into getting qualified as a health coach, and then the journey's taken me into the NHS as well as offices.
Mm.
So it's trying to bring more awareness and get people achieving better health. Which, I truly believe that when you get the right conditions, your
Mm.
default state is happiness and health.
Yeah. But I mean, you're right. It's the environment plays such a big role, right? When it comes to conditioning us and setting us up for either success or, failure, because there are so many things that impact the choices that we make on a daily basis. And it's so interesting. So I know about your journey when you quit your job, right? And you just decided to travel. Was it Nepal and India, right? And you
Yeah,
trekked the Himalayas, and it just sounds like such a great adventure. But the environment changed completely, right? So you got away, like you said, from Western life, and you had all these big changes that kind of just happened automatically, if I understand it correctly. You just automatically ate better food, right? And you didn't watch TV, you didn't have much screen time, you were in nature more often, I guess. Um, so yeah, it's quite interesting how when we are taken out of our environment, it is easier. But the thing is, we can't all do that. Right. It's not always possible. I mean, I would have loved it, but it's not possible for me currently to go to India, right? Or many of the listeners in our audience. So, is it possible to bring these changes back into our modern life, even if the environment is not supporting us? How do we do that?
Yeah, good question. I think it's definitely possible. It's not necessarily straightforward, but it's definitely possible because 50 years ago, in the physical and mental environments were a lot different, but we were all kind of healthier by default.
Mm.
But bringing more awareness to everyday situations is probably the first step, and just acknowledging that our environment isn't set up for creating health.
Mm.
Then with the power of health coaching, I mean, it's asking people firstly, how are you doing and where you want to get to. And I think that's kind of two really simple questions that I start most conversations with, whether it's the first consultation or sixth or seventh or whatever it is.
Mm.
And I mean, I don't think that the rules of good health probably won't ever change. If we're putting the right, given the right inputs, we get a better physical and emotional and mental health overall. But it does require a bit of puzzle solving, and each individual comes with their own unique situation and environment and home situation, and we're all exposed to unique stresses, whether that's family or work. But I kind of like the term puzzle solving because it's possible to solve, but it's one piece at a time. And it's very, very fulfilling when you do get the right piece with the right person.
Absolutely.
Yeah.
And I think that approach is so important, that one piece at a time, because otherwise it might feel very overwhelming, right? To wanting to change everything, and where do I even start? But if we're just focusing on this little small piece in front of us, what is doable? What is the next step? Then often that creates that upward spiral of success, helping us to achieve more as we go along, right? Um, so thinking about so I think this whole theme around the environment and how it impacts us is quite an important aspect to look at. And I know that this is something that you do when you are working in the field of corporate well-being, right? So yes, you also work with the staff, often on an individual level, but it seems like you also help to transform the culture of the business, if I understand it correctly. So do you focus a bit on the bigger picture as well, or how do you do this? How do you create change on this level as well to transform the culture of the business?
Yeah, that's a good question. I think each individual business and each individual company is going to have their unique challenges. But I think culture is a good word, and I think culture is just a bunch of people who are copying each other, put it simply. Because going back to my Nepalese days, like you'd have like everyone wearing the same hat, but then if you go to Vietnam, they'll be wearing a different hat, and so but then if you're having these behaviors in a Western office, say in a solicitor's office, and everyone's kind of stressed out and eating one example is like eating their food or eating their lunch at their desks, and you probably realise that that's maybe not the most healthy way to eat a meal when you're just shoveling it in and tapping away, not really conscious of what you're eating. So, one example I've just offered general office workers is sitting away and having a chat with colleagues away from screens, and also it does really help if the boss embraces this as well, because if you're not acting out and being the change that you want to see other people do, then that's kind of you're not walking the talk. And if you're a parent, you know that kids they copy your actions, not what you say. So it has to come and be embraced by the management, particularly. So then for them to and act out on their aims and how they improve their culture. Initially is opening a conversation about how they would like to change and what their goals are as a team and as a business, as a culture, and that opens the discussion. And if you can get people coming up with their own ideas, although we have easy suggestions, maybe it is like having a team lunch or a team walk at lunchtime or before work or whatever. But it's got to be practical, but it's got to be embraced by the top down. But yeah, each business and each kind of sector has their own pain points. So it is interesting speaking to different companies around what they're currently doing and what could they improve, whether that's mental or physical again.
Yeah. So do you typically work on an individual basis with the boss or the management team, to help them to kind of set that scene? Like you say, they need to embrace it themselves. They need to walk the talk. Or where would you start?
Yeah, I've been typically asking, depending on the size of the business, the HR person is often in charge of that side of things. So it'd be approaching them, or if the business is of a certain size, it's possible to speak to the manager of the business. But it is just opening the conversation and then seeing what they would benefit from, whether it is a team workshop, which I've done a few things on, or would your employees resonate more with one-to-one? So that's kind of asking them what would be most appropriate.
Yeah. But I think the concept of like you're saying, walking the talk, or embracing a healthy culture, a healthy way of living, so important when it comes to the structure of a business. But what are your thoughts on, as a health coach, how important it is to prioritize your own health, and also kind of practice what you preach, right? Do you find that that's also important when practicing as a health coach?
Oh, 100%. Yeah. Otherwise, I don't feel authentic at all
Yeah.
if I'm not
Yeah.
developing my own and maintaining my own healthy habits. And yeah, it's not always the same pattern, but I always, since I had that year away, actually, I've been big into morning routines and starting off with some element of exercise, some element of mindfulness or meditation. So yeah, there's kind of and I can do a morning routine within 5 or 10 minutes. So and I really like the concept of how you start your day can influence your day. So if you're choosing to start well, whether that would be writing a journal, reading a positive book, or doing yoga or whatever it may be, I often lately I'm just trying to start my day with a morning run, no matter what the weather. Just do it because I know I feel better. And yeah, so and I've since the last 5 years, I've just had a non-negotiable. I'd never buy sort of takeaway or convenience food. So I've kind of drilled into that. My identity now is always cooking, or if I'm out, I often fast as well. So that was something I'd never do like 10 years ago when I was in my London office job eating junk. And so yeah, totally changed my or upgraded my habits from say 10 years ago when I wasn't in a happy and healthier place. So yeah.
Yeah, but it's fantastic that you were able to bring it back home for yourself, right? After the whole adventure. But something that I'm curious about, so just going back to that moment when you decided, okay, this is it. You quit your office job, and you just decided to go on this adventure. So just tell me a little bit more about it. I'm really curious. What was going on for you? Did you just wake up one morning and decide, okay, that's it. I can't do this anymore. I need something else. How did it happen?
Yeah, I used to work in the travel industry, so group travel and adventure tours, and it sounded really glamorous. Sometimes it was, like we got to travel, climb mountains, and I climbed Kilimanjaro and Mont Blanc, and cycled around in India and places like that. So yeah, it was great for that part of the job. But yeah, day to day, after sort of 10 or 11 years, I think it was just not fulfilling me. I worked 7 years for the same company in London, and then they set up an office in Melbourne, which I jumped at as well, because I thought changing locations and all that would fulfill me and all that kind of thing, which it did partly, but deep down it didn't really light me up as a day-to-day job anymore. So I was on the cusp of like contemplating applying for Aussie residency, but then I decided against that, and then yeah, that was my opportunity to have a year out and just reset my kind of values really. And because I yeah, sort of had some bad mental habits and went through bouts of depression, and also I had gum disease as well, for probably started 10 years ago. And I had no awareness of that, about the fact that I was eating processed junk. And what I listened to through podcasts and reading books about dental health, that's kind of a canary in the coal mine for the rest of the body. Because if you've got poor gums and teeth, then and that, the teeth are the hardest substance in the body, and if they're corroded by the food that you're eating, what the hell is it doing to the rest of the body?
Yeah.
So I'm big into dental hygiene now, because it has such an impact on your overall health.
Yeah.
So I'm really on the ball with that now. So and it's just come from awareness and self-improvement really.
Yeah. So you were just kind of at a bit of a almost, you wanted to reset your vision, your values, what it is that you wanted to get from life, and you decided to take on this little adventure and journey, right? And did you get from it what you hoped you would?
I think I wasn't really expecting, I wasn't sure what I was expecting actually, but I learned so much about mental health because I did some retreats in Buddhist monasteries, listening to sort of monks lecture for kind of 10 days in a row. I did 3 of those in Nepal and India. I trekked in the mountains, and just by default, all the food was freshly cooked. And my sleep habits were a lot better. And learning about how to manage stress and how to manage the mind through all these amazing Buddhist sort of bits of knowledge that I was picking up, and reading books and listening to podcasts rather than watching TV. That was a big one for me, and I still don't watch much TV now, and I definitely don't watch Western news, because that's kind of not great for mental health. And so I try and curate my content, whether that's reading or listening or watching, so it's always kind of educational or uplifting in some way. So and just the adverts we're exposed to on on radio or TV, I kind of switch off, and I'm so much more aware of that side of life, and try and limit myself to advertisements as much as I can, because I just know they're mind manipulating really.
Yeah, exactly. So it seems like you were able to really make quite a big shift in terms of where you were and where you currently are, or heading, right? So it's, and so do you feel like this is possible for most people out there? Even though they might feel like they're completely, like you said, maybe feeling very depressed or not getting any satisfaction from your life. Do you see that with most people it is possible to change direction in life?
100%. And just the Buddhist teaching that I ream off all the time. I mean, like, change is constant. So whether you're changing for the better or for the worse, we get to decide what we do, and we can always we've always got the chance to change and opportunities to change, and we can learn anything, and we get good at what we practice. So whether we're practicing poor mental habits or physical habits, we get better at those. But we've got the chance to sort of practice another way of life. And one analogy, I saw a therapist about 6 years ago, and she said, like, we imagine you've got a radio in your head and you've got a DJ, and whichever station you're tuned into, so it could be, she used the term shit FM, which and I was tuned into that station for years. But if you have another station, whether it's like happiness or positivity or whatever you want to call it, you've got the chance to do that. And using skills like meditation or mindfulness, you can become aware of your mental patterns and change the station. So it's always possible, but not necessarily easy. But with skill and practice and awareness, And yeah, that's where coaching can sort of improve those skill sets for a
Yeah.
lot of people.
But it's often those mental patterns, right, that you're referring to that's tripping us up. Not so much always the reality. It's more about what we think about the situation, right? That tends to trip us up. And I think one area that's quite common, especially perhaps with people starting out in a new career. So I work with lots of health coaches starting out on their journey. They're setting up their business, very excited, but often I think one of those mental patterns that is very recurring is not feeling good enough, especially when you start out. And do you also come across this quite often, that I almost want to say a bit of an innate human mental pattern is to not feel good enough at times? Is this something that you also often see in your work?
Oh yeah, definitely. I experienced that myself as well.
Yeah.
I think when you're working alone, whatever industry, yeah, imposter syndrome and
Yeah.
having doubts about what you can bring to other people. Yeah, that's a common thought pattern. But yeah, it's maybe like limiting beliefs is something that coaching, whether it's health coaching or life coaching, whatever, that's addressing limiting beliefs, and beliefs aren't truth. And that's coming back to my Buddhist learnings as well. Like, it's kind of objectively seeing situations with a different perspective, and our repetitive thoughts are often not truth. And just acknowledging that, and then saying, oh, what thoughts could you steer your attention to that are more empowering. And often another kind of simple concept I've kind of embraced as well, when you're thinking about your own limitations, you're not thinking about the service you can provide others. So you direct your attention on what service you can bring to that individual or that business, then you're getting away from your own ego, which is then more empowering to yourself as well as the people you're working with then.
Yes. So really moving the focus away from yourself and
Yeah,
showing up to serve the person that's sitting in front of you, right?
yeah,
Um,
exactly.
mm,
So you're saying, like, you're shifting from I'm not good enough to what can I bring to that organization, or
yeah.
what can I bring that person.
Yeah, that's beautiful. But also, like you say, having these formal practices in our life can also really serve us in that regard, right? So just having that awareness, number one, I think in most healing journeys is just having that awareness. Okay, there's that thought, saying that I'm not good enough, and then maybe getting some distance from that, right? It's just a thought. It isn't necessarily the truth. And then maybe even, focusing your attention on some other more supportive thoughts. But this takes time, right? It isn't something that's just gonna change overnight, right?
Yeah. Again, like, you get good at what you practice, but if you can entertain different thoughts and more empowering thoughts, you can hopefully get more of those, more of a percentage of empowering thoughts perhaps than you were once thinking. So
Yeah,
that then hopefully becomes your more empowered identity over time.
yeah, yeah,
And yeah, with coaching conversations, you're then using that as a tool to kind of enhance those more empowering thoughts and beliefs about yourself and what you can bring to the
mm,
world. Um,
mm.
so yeah, it does take practice, and yeah, everyone's got their own unique backstories about what they can and can't change. But yeah, again, like, change is constant, so it's kind of, how do you
Mm,
want to change?
yeah. But I think it's very important to do this type of work on ourselves, when coaching clients as well, when we typically have to deal with the same types of things, clients not feeling good enough, and doing your own work can really support you in that regard to show up in a better way as well, right? So just on a bit of a different note, I know that you do health coaching for the NHS as well, right? And you've been doing that for quite a few years now. So, can you give us a little bit of an idea of what coaching looks like in the NHS? You know, what type of patients do you work with? What do you typically help them with? What are the coaching approaches? You know, what does it look like in the NHS?
Yeah, so I work 3 days a week in GP surgeries in the New Forest. I was
Mm.
full time, but I've just gone to 3 days a week. So yeah, my patients are referred to me by the GPs and the nurses. So I deal with people with lifestyle kind of imbalances. Maybe that's type 2 diabetes or obesity, or they're dealing with stress, anxiety, or depression, or combination of a few things. And my appointments are from half an hour to an hour long. So rather than a 10-minute GP appointment, you've got the opportunity to sit down and offer them time and space, which in the NHS is a free resource. That's quite a luxury for the average patient, because if they're used to having 10 minutes only and rushing through an appointment, this is a totally different approach. So you can really have some good success for those patients who are ready to make a change, but they needed a little bit of a hand to do so.
Wow.
So yeah, mostly they're one-to-one appointments, but I have done some group appointments as well. So workshops around how to improve sleep and how to improve blood sugars. So that's just conversations around different food swaps. And I've used a lot of resources from the public health collaboration, because there's one GP in particular, Dr. David Unwin, who's had a lot of success with his patients reversing type 2 diabetes and pre-diabetes, which I've had not as much success, but yeah, I've had certainly patients who've come off all their medications and lost weight and just feel more in control of their health,
Mm.
having made these changes, whether that's with the one-to-one or the group, or a combination of both, actually. So I find when in the group situations, it's really satisfying when you ask one question and then the patients kind of answer it amongst themselves and help each other out.
Mm. Yeah,
But
that's a
you're
different
kind
dynamic.
of
Mm.
yeah, and I'm fortunate enough, like I've been given quite a bit of freedom to kind of create these group workshops, and with the encouragement of a couple of GPs that have been helping me facilitate them. So yeah, it's kind of really quite satisfying when you get the right people in the right place and ready to
Mm.
change,
Mm.
and embracing a bit of coaching along the
Mm.
way.
Yeah, and it's great that in South Africa we don't have a free healthcare system, so it's a bit different, and I think it could be so beneficial to the bigger healthcare system if there are coaches in roles like you've been describing. I think it could be really, yes, no, from a reactive type of healthcare model as well, but actually more a preventative. I think that's actually even more important if we can start seeing clients before they get to a very critical stage. I think that's where health coaches can also support people, right? So, what what are the kind of the pros and the cons of a free healthcare system? What would you say? What no, let's start with the pros of a free healthcare system.
Yeah, good question. Well, yeah, it's getting over any financial kind of addressing the obvious stuff first. um, and yeah, they do some great work, and I've learned a lot through my 4 years working with the GPs. But yeah, you're right. Just prevention is not one of its strengths
Mm,
as an organisation. So hence why I'm trying to go upstream and into businesses to keep
mm,
people well and be more
mm,
proactive and preventative. Because from what I've seen, like yeah, if you've got type 2 diabetes, that's been a condition that's been building up for years or decades, perhaps. And if you've got the right tools and the right awareness and the right kind of tactics, if you like, earlier on in life, you can avoid those chronic lifestyle diseases.
mm,
And it is a bit. I had one patient in particular who was diagnosed with type 2 for 20 years, and within we had 6 or 7 sessions.
mm.
She kind of reversed her condition, and she'd never known that was possible.
Wow.
But I'd known that that was all I'd never known, learning from the likes of David Unwin, who's done it, hundreds of times, literally.
Yeah.
But this patient wasn't getting the right empowerment or the right hope or any hope from the clinicians in the surgeries. And that's no disrespect to the clinicians, because they all have a lot of things to do on their daily schedules. But having the time and the knowledge around what kind of foods and lifestyle habits could get her off and in better health, she's like living a much happier and healthier life now.
Oh, wow.
So that's just one. That's probably my favourite patient I've dealt with, because like she's just lost a lot of physical weight and mental weight as well, because she's more now in control of where she's going, and she can enjoy like playing with her grandkids, where she was like low on energy in the past and didn't have the energy to keep up with them. So now she does have that.
Yeah, so I mean, the fact that the healthcare system is free gives more people access to these types of experiences. I mean, reversing certain diseases, but also, yeah, like we talked, I think also having a bit of a proactive model in place to help people to set up well-being. It's not just about fighting disease; it's also about feeling good and thriving, right, and having energy to kind of live your best life, right? So what are some of the cons? Are there any cons?
Oh, I think some people, the UK culture is maybe you wait to get broke and then get fixed,
Yeah.
and reliance on lifelong medications, which will have their downsides for sure. I mean, medication certainly got its place, but I've all the podcasts I've been listening to with the more proactive doctors frame the NHS GP surgeries as maybe like they're managing sick care, but not creating health.
Yes.
So when you reframe it like that, and with the empowerment and the hope that chronic diseases can be removed from your life, for want of a better word, with diet and lifestyle change. And I've seen many times that blood sugars and blood pressure and joint pain and weight, these all are conditions that can be improved, or if not resolved, with diet and lifestyle change. And it's just having that more empowering beliefs, and giving hope to patients and helping them stay supported and accountable to change their habits. And when we do that over time, I've seen it, so I know it's possible to put people back more, zing in their step. So
So do you find that this is an area of work where more coaches are needed in the NHS?
Every GP surgery in the country now should have access to a health coach or multiple health coaches. So it certainly is a benefit, and it's good to see. However, some patients, because it's free, they don't sort of embrace it, and therefore, the private work does have its benefits as well, because like people, when you buy a service, you're more likely to embrace it then. But I've learned a lot from. I've certainly found the experience valuable working alongside GPs and nurses. This was and working all through the COVID times and switching the coaching to phone based, which had its challenges for myself as well as the patients sitting at home. So that was like a valuable experience. I learned a lot through that time. But people could benefit from more prevention, which the NHS doesn't have a model for right now.
Yeah, but I really like the idea of certain industries or practitioners realizing that we kind of need the support from other professions as well, right? So the GP and the health coach working together, right? So it's not that common in South Africa yet. So I think maybe it will change hopefully soon, in a few years' time. But really taking that multidisciplinary approach that I can support you, like you said, creating that space and time to really figure it out with you. What are the lifestyle and nutrition changes that you could make that could really make a big difference in your life, right? But then also the doctor supporting you to also get the right support in that regard. I think it's so important for these different things to come together to support someone in the best possible way, right? Um,
Yeah,
so
I
so
agree with that.
what are the types of coaches, or do you feel like this is for anyone out there, or do you maybe need a specific personality to work in for the NHS? What type of coach should apply for this type of role, do you think?
I think people come to NHS coaching from all kinds of experiences, and at the moment there's not a kind of an official qualification that you need to become an employee as a coach in the NHS, although there are training courses, but they're not as in depth for sure as anything that's embraced in the UK by HCA or Health Coaches Academy. Because many of the courses available in the NHS are only sort of 4 days long, so it's not sort of it's not a specific requirement. Although having membership of the UK IHCA certainly has helped me, and it's kind of daily practice now because I've had hundreds of patients I've seen and done hundreds of hours worth of coaching. So I it's kind of helped my identity and my beliefs about I am a really really good health coach because I've got evidence now. So if I'm having like doubts or those negative patterns, which I clearly do get because I'm a human, I kind of have a bank of kind of success stories that I kind of tap into when I'm in those more negative patterns which come and go. But yeah, it's just improved my confidence and improved my experience because I've got sort of money in the bank,
Yeah.
having done 4 years.
Absolutely, that years of experience, I mean, of course, it adds to your confidence and just the way you practice. I can really see that. Um, so Ollie, is there anything like any last thoughts that you maybe want to share with us? Maybe some of the newbie health coaches starting out on their journey, maybe words of encouragement or something that you feel like they maybe need to hear at the beginning of their journey.
Yeah, I think it's always possible to achieve like new things, and it's really fulfilling, rewarding career because you're helping people help themselves, um, and yeah, you learn a lot about yourself when you're studying to become a coach because you get coached and you then practice coaching the other people. Um, so, but yeah, it takes time like any new skill, and but the more you practice, again, like you get to improve yourself and have a improved identity, I think.
Yeah,
So yeah, it's a rewarding process, and
absolutely.
whether you have that as your profession or you want to do that uh, part time, whatever, you will definitely improve as a person, and
Yeah.
you'll have probably better relationships with yourself and others, whether you're colleagues or family or whatever.
Absolutely. Yeah, and it also kind of transforms your everyday relationships with people as well, right? Just being able to show up and listen to the people around you when you've got these skills to be able to to coach people. So thanks, Ollie. Where can our audience find you if they want to follow you, if they want more info on what you're offering?
Yeah, I have a website. It's just ollyleicester.co.uk, and I'm on LinkedIn as well. I haven't really embraced the social media side, although that's maybe one area of like limiting belief I have, or yeah, I'm conscious about my time management as well. So if I embrace more platforms and more ways to do that, but yeah, that it may be possible in the future, but right now I haven't got the energy to kind of devote to it.
Yeah.
Although yeah, that's kind of there's plenty of ways to explore that side of life and business.
All right, good. Thanks, Ollie. Yeah, it seems like you've really been on quite an exciting health journey yourself, and I can really imagine that the people you coach, the private clients, but also the NHS patients really benefit greatly from your support. So thanks for telling us more about your world, and also sharing with us what is possible for other health coaches out there. So thank you for joining us today.
Yeah, thanks for having me, Zena.